Welcome.
Thank you.
Can we start with talking a little bit about you and kind of your background and how you got into this work that you're doing now?
I would love to chat about that. For me, I feel like it is representative of just my family and my background. I grew up in a multicultural, multiracial home. So thinking about the world through multiple perspectives has just been innate. My mother's Jamaican, my father's Norwegian and Danish. And so even like the concepts of time and worldview, those were really active conversations in my youth. And then I have grandparents that did a lot of service work in Jamaica and around the world and really brought myself and my cousins into that. So this kind of worldview of not everybody lives the way that I live, or not everybody understands the world the way that I do, really, I think, was foundational in just my upbringing. I remember from a really early age thinking that I wanted to do something that helped support people that were either vulnerable or didn't have the control over, their lives and how things manifested for them. And so that led me to really think about children. Initially I thought that I was going to be a physician and I wanted to work with kids. And then I took my first psychology class in high school and just like blew my mind. It's like, oh, this is another way to heal. Yeah. This is another way to think about healing, where you can actually get to know someone and why they think the way they think, how their backgrounds inform what may be causing their suffering. And from then on, that was it. Yeah. I didn't have eyes for anything else. I would say that the international focus of my work, so being a psychologist, my specialty is international psychology and human rights. I know that that's because of my, early childhood experiences of the world was really big to me then. It wasn't so small as it can be for some. And so I really wanted to work with survivors of trauma and torture and study liberation movements and why do genocides happen and what does dehumanization mean? Like those were like the big thoughts in my mind as a teenager. And that really kind of guided my path. I work as the Vice President of Diversity, Equity, and Inclusion at the Medical Center and still practice psychology in that system. And 100% the way that I think about DEI work is informed by those early life experiences, but also psychology. Like, how do we define healing? How do we define suffering? That means something different depending on who you're talking to. I could go on, but.
That's wonderful to hear. Your background, clearly, there's clear through lines to the work that you do now. One of the points that you brought up is how do we define healing? And obviously we don't want to jump right into it, but in your kind of professional life and personal life, what is the conclusion that you've come to? How would you define healing?
The conclusion that I'm at is healing is defined by the person that is seeking it. That as a professional, I don't get to define that for the clients and the patients that I work with. What does that mean to them? What does that mean to their community and their belief system? And the same goes for suffering. When I was doing my dissertation research, I traveled to Brazil and I was in Salvador, Bahia, and that is just this most incredible, magical place, but also like deep trauma and like a deep history of violence. In the New World, the largest amount of African slaves came through that port in Bahia. And so you can just feel just the energy there. Yeah. And what I was studying was, Afro-Brazilian modes of health and healing. And do belief systems support healing or can they be oppressive in some regards? And, it was really fascinating to just sit with folks and recognize that every single person I spoke to had a different answer. I see that in my own clinical work. I think about that for myself. And really practicing from a liberation psychology standpoint, that's what that whole premise is that, the healers and those that may have the higher degrees, like we're not the experts on the individual human experience. It's subjective.
Can you tell us more about liberation psychology?
Yes, I would be happy to. It's one of my favorite things to talk about. So liberation psychology was coined by Dr. Martin Barro, who is a Salvadorian Jesuit priest who is also a practicing psychologist in El Salvador. He was murdered by a U.S. backed death squad in the 80s during the Civil War. And I studied abroad in El Salvador for a bit of time when I was an undergrad, and was just profoundly impacted by his work, but also the way that he really called us as psychologists to practice. He focused on really challenging who's the expert in the room, recognizing that we can't understand one's experience of suffering from a decontextual context, meaning you have to think about the context of the people that you're sitting with. You can't just think about a trauma as an individual, like internalized experience. It impacts the community, it impacts the family. And so it just blew my mind. You can't practice from that standpoint without being vulnerable in the healing space. It has to, in some ways, break your heart too. Like you have to enter into that space and, recognize what you don't know, but also trust that the person that's seeking healing, has all the tools to heal themselves already.
Wow.
You just get to witness it.
Wow.
Yeah.
That witnessing of someone else's healing is definitely a perspective I haven't heard as thoroughly as you're talking about now. It does make me think, from what I know about you, that you've kind of kept some of you're still practicing currently, even as the assistant, the vice president, right?
Yeah.
How does that? Why did you choose to do that, and is that informed by these principles of healing? What does that look like for you?
Yeah, I don't think I will ever give up being a psychologist. And yes, I have the degree or the title, so I can technically say that I am, regardless of if I see patients. But I want to practice and be one, you know what I mean? And it's a skill. So just like anything else, if I don't practice it, I'm fearful that I'll lose it. So the way that it looks for me, I had a lot of conversations before accepting the DEI role about maintaining my affiliation with the Department of Psychiatry. I'm still in the training team and supervise residents. And this year I have 2 residents that are doing a year-long liberation psychology seminar with me.
Wonderful.
So they're specifically seeing cases and I'm supervising them from that lens. And so it's teaching and clinical work, and it's great. It was important to me to continue to work with all of the outpatients I was already seeing. I did not want to discharge anybody from my caseload. And so it's been a bit to navigate.
I can only imagine.
There's a lot of competing demands,
Yeah.
but I've had a lot of support from my leaders to protect my clinical time.
Wonderful.
And I'm not the only colleague in the kind of operations team for the hospital that still practices.
Okay. I imagine, I guess in my experience from what I've seen is as people rise into more leadership or executive roles, they don't have as much time to do the technical side of what brought them to the work.
Yeah.
And I find that being able to still practice as a clinician helps you to stay grounded in what is actually happening in the work. Even with the Vermont Health Equity Initiative, we're always trying to bring it back to what it actually looks like and make sure it doesn't get too high level or too academic or too kind of outside of the scope of what is people's reality. So it's nice to hear that you're still doing that, and I imagine you'll continue for a long time, but it's nice to hear that. I appreciate that.
Yeah, thank you. I one of the things that Dr. Leffler, the president of the hospital, was saying to me as we were in conversations about this role, he still goes down to the ED on some Friday afternoons, and he jokes about how they give him the easy cases because he's not down there as much, the emergency department.
Yeah.
And so his advice was, don't give up the clinical. Because you're right, there's something about one being relatable, but also you need to have a pulse on what providers are experiencing, what they're feeling, what the pressures are during being in healthcare during this time, and then what the patients need. So I see it, just the synergy of it all just feels really right.
Yeah. I imagine that's particularly given the COVID pandemic and what practitioners and anyone in the medical field had to go through in that time. I imagine having a pulse on what that actually was like, because times had changed so drastically and so quickly. And maybe that I imagine it would inform how then leadership would make decisions about how they move around resources or staff. Or
Yeah.
Can we talk a little bit more about the pandemic, given that we're coming out on the other side of it right now, thankfully?
Yeah.
When you think about the pandemic, how did that impact your work? I know kind of entered the realm of your position right in the kind of the mid of the pandemic, but can you talk a little bit more about that?
Yeah, I'll back up even to before the pandemic, because there were a couple of pandemics going on, right? There was the racial reckoning that was going on in our country, and I would say that impacted me so deeply in 2020 in terms of how I practiced and the work that I did. And so I'll share a little story about how that kind of led me more into some of the organizational DEI work, because I was doing DEI within the Department of Psychiatry, and looking for ways to impact it on a larger level. But the system wasn't totally ready at that point. But, when George Floyd was publicly murdered, among many other people during 2020, it was increasingly difficult for me to just do an individual clinical encounter, knowing that the majority of my caseload were Black and brown folks that were dealing with real trauma, and I would sit with them for 50 minutes and then they would leave my office. And I know they were going out into systems that were not equipped for their success, or not even having conversations about the impact of what was happening nationally on their own well-being. And that was so hard. It was hard to know that for my patients, but also hard for myself, because I wanted to be having those conversations too where I was working. And so then I just started thinking about, I need to do something more on the systems level. As a psychologist, we're trained to really think about process and systems, whether it's the family system, a couple, dyad, or an organization. And the organization, became my client. It's like, there are folks hurting here, and they're needing these conversations. And so that's how I started doing the racial equity listening sessions. Okay. And luckily, Dr. Loeffler was like, we're never going to stop these. Wonderful. And so over 2 years later, we're still doing them once a month. They've evolved, but that was why it started, because we just had to have the conversation. And then, that kind of made way for more work. And then, there were so many champions within the organization that were like, oh, we can't just say that we care about this. We have to demonstrate and actually put some resources behind it. So that informed it. And then all of that, then there was the COVID-19 pandemic, obviously, that was going on during that. And there were some other crises that were going on within the hospital. And, it really made way for more conversations around health equity, around, vaccine, and then the real fear that so many communities of color and mistrust about the vaccine. I felt that in my family. And so it's been incredible to see how things have just kind of unraveled in terms of some of the defensives that a large system can build up. Definitely. We're like, wow, we need community partners like VHEI. We have to partner with folks that are on the ground doing this work.
And I mean, even us, when we started this work with VHEI, a lot of the work, it started out advocating for equitable vaccine rollout policy and turned into a much broader conversation and actions around what do people need in order to access this life-saving resource. And it is education on the topic. It's comfortability. It's allowing people to feel like the people that are giving them this vaccine are here to help them. It's access to the clinics themselves. It is language translation, interpretation. It's childcare. All these different societal, systemic factors that, with every new family that came in, we would modify and try to add resources and get the right partners involved. But you all were a big partner, because we too, as a community organization, need the institutions with power, resources, historical backing. So the partnership piece of it is essential for us as well. And I don't think we would have been able to do it without all the partners, community partners, grassroots partners, as well as institutions. Yeah. So that partnership we still have now, and obviously hopefully will grow. But can we talk a little bit about then the pandemic comes through, and a lot of the conversations we have at VHEI now is around the impact of the COVID-19 pandemic, the racial reckoning, as we'll call it, and all the other factors during the last 2 years that have led to a shift in kind of mental health in Vermont for BIPOC people, for all people all over the world, certainly. But we think about being a person of color in Vermont has already, it's, as someone who grew up in it, already comes fraught with its own challenges. The pandemic and George Floyd's murder then ignites a new set of challenges and kind of leaves us in this place in 2022 where there are a lot of people that need a lot of support. I guess what's your vantage point on all of that broadly, and we can get into details later.
Yeah, I mean, I think so much of that boils down to access, and it's not just about, are there enough providers, but also what's the training of the providers, what's the demographic of the providers, the mental health providers, because there could be, we know this isn't true for Vermont, that there, are a lot of openings and there are a lot of, providers regardless of like racial or ethnic identity. But then when you think about like the cultural humility and the training and really the specialty of working with trauma, but not just trauma broadly, like racial trauma, I have some really big concerns about that for just our communities, but also, our state. We see so much of that within the hospital. It's not a secret that, there's psychiatric crisis going on throughout the state, decrease in psychiatric beds. We see that in our emergency department. It's a really big problem. I don't have all the answers to it. I don't know that any of us do, aside from partnerships and advocacy is crucial to moving the needle on that.
Advocacy, when we talk about that, what are the things that you, I guess, given the platforms that you have, try to advocate for the most?
Yeah. That's something that every week we have a kind of senior leadership operations meeting in the hospital. Every week, the mental health crisis is on it. So there has been advocacy that's been at the top level with the state government, local levels. We've been looking at capacity in terms of our own psychiatry and psychological services department, partnering with other providers throughout the community, advocating for increased people resources to be able to offer more services, partnering with some of the community organizations that are really working on the access for BIPOC communities with mental health, like Inner Space is an organization that comes to mind. There are a number of us at the medical center that are on the advisory kind of board and council for that organization. And then, one of my other roles is I'm on the Community Health Investment Committee. And so that is really connected to our Community Health Needs Assessment, which you may be familiar with. Yeah. And so this investment committee, we have $1 million a year that the UVM Medical Center invests into the community that is specifically targeting some of the priority areas identified in our CHNA process. And so it's been mental health for the last few years. And so much of my role in that committee has been not only to diversify the committee members and what that looks like in terms of membership, but also our application process. Are we asking about the communities that these organizations serve? Is there accountability built into the grant, funding? And so we have seen such an increase of funding for diverse community partners and organizations. So that's one example of, if I hear about something, I'm like, do you know about CHIC? Do you know about the CHIC committee? Apply for the grant, because even if you miss the grant cycle, there's emerging needs funds. Right. And so really trying to just funnel more resources to the partners that are also really tackling this problem.
I guess at the institutional level, that you've given us a really good lay of the land, kind of as you see it. Can we talk a little bit about more as a Black woman in Vermont and as you have a family in Vermont here too? I guess what has been your experience living here and how that's, I guess living here in general, how it impacts your mental health or the mental health of Black and brown families in Vermont, and how the kind of being in a predominantly white space in your workplace as well as your neighborhoods, what that means towards mental health and what it tells us.
Yeah. Oh, so much to say about that,
Yeah.
Belan. It's something that my spouse and I talk about probably every day. To be fully honest, for the first 2 years living here, I didn't think I was going to make it. Like, really didn't think I was going to make 5 years here. We're here now 5.5 years. We don't have any plans on leaving. Like, we have put down roots in the community, but the amount of energy that goes into needing to really cultivate a community, not just for myself, but for my 3 children, they're school-age children, and their racial, ethnic, and cultural identity development, being Black children growing up in Vermont, is at like the forefront of my mind all the time. To the friends that we make, the schools that they go to, even the hypervigilance that I feel around needing eyes on the curriculum that's being taught to them. It is a lot of energy, and it would not probably be as much energy if we lived in a more diverse, ethnically diverse, I would say, community. With that said, we recently just moved into Burlington because we're like, okay, if we're in it to win it, if we're going to be here, then this is the community that we want to live in. These are the schools that we want our kids to be going to. So that feels really exciting. Thank you. I'm excited to just get more involved in the community and learn more about just even some of the politics in Burlington and all of those kinds of things. But it is a concern. There's a lot that we've done to try to have open conversations with our family, with our children. But every day we think about it and we talk about it. When you have a young child that's 6 coming home saying, there's a lot of new kids in my class and I really wish that they were Black too, or I really want a Black friend in my class, like, kids notice these things. They notice it from when they're toddlers. And so, that hits a bit different when it's your kid. For myself, being a psychologist in this community, being one of the only licensed psychologists that is a Black woman, and then just broadly a person of color, it presents its own challenges and opportunities. I get to support a lot of really incredible people. And because of my own ethics in my profession, I don't ever get to socialize with them or make friends, So that's been something that I've had to balance and navigate, because when a new patient comes and wants to see me, I have to really think about do we have circles of overlap? Am I going to see you at a kid event? Do we have shared?
Maybe, yeah.
Right. And because it's a small community, it usually does happen. But there have been people that I've said, actually, I'm gonna refer you to somebody that I know has done the work, and I think you'll be in safe hands. Let's be friends instead.
Yeah.
And so having to try to explain that is another element that I never dealt with when practicing in Atlanta or Chicago, for example.
Sure. Wow. So you have a pulse through your role in the institution. You have a pulse through your role as a practicing clinician, a pulse on it all through your children and your family. In all of that, I guess, what would be kind of your message about what it looks like, if you wanted to summarize it, what it looks like to be a person of color in Vermont, how then that impacts your mental health, and maybe kind of like what your bigger takeaways are from that?
Yeah. I don't know how people of color will make it and survive here without community. I think those first 2 years when I felt like I was really struggling and seriously thinking about moving back to Atlanta, I was lacking community. And that has probably been the biggest shift for me. When I think about, Audre Lorde's quote, there is no liberation without community. If we are working towards our own collective healing, it is not going to happen in isolation. It's not going to happen in isolation in an individual clinical encounter, but also just our own well-being socially. We have to connect. That's probably been the biggest thing that I've learned and that I've done just for my own wellness, and probably advice that I'd have for others is get community, find community, hang on to it, cultivate it. And for me, that looks diverse. Being a multiracial woman, I feel the most comfortable in diverse, multicultural communities. So I actually love living in Burlington. You know, because even when I was in Chicago or Atlanta, I have friends that, you know, are from diverse religious backgrounds, racial, ethnic backgrounds. Like, that's when I feel the most alive. And there are opportunities to have that here.
Absolutely. Definitely what you said about kind of, it's not until you find community that you can really understand imagine yourself staying here.
Yeah.
Having grown up here and having had that lens my whole life and never feeling that sense of belonging until, I'd say, the last few years, I guess. Obviously the pandemic and George Floyd's murder sparked a lot. The one thing, I guess, one of the silver linings that it sparked was, I think in Burlington there's a stronger community sense that I feel like I feel lucky and honored to be a part of now, and that's the thing that keeps me here as well. So to your point, building community, and through that, community healing was a concept that you said, which actually I'd love if you wanted to talk a little bit more about what community healing means, especially given what you referenced before, there aren't that many practitioners of color, and then given that there aren't a huge amount of resources, how do we as a community end up healing together?
Yeah. You know, I think about that a lot, just being a trauma psychologist, because what, you know, the research shows us, and I say research in quotes because, you know, it's the people, the stories that we know about, right? And so there's a lot that we could unpack there. But over 80% of adults will experience at least one traumatic event in their lifetime. And so, you know, there are so many people that are walking around with trauma, and normalizing that, talking about it is important, but recognizing that for many communities of color, the trauma doesn't happen in isolation. It happens in community. And so, you know, what restorative justice practices teach us is that trauma is happening in a group and in a community. The healing has to mirror that. And so that, to me, like, really informs that work. And that's kind of how I would answer that is, yes, we may not have a large amount of practitioners of color in this community or in this state. And healing can look so many different ways. So what about the paraprofessionals? What about the faith or spiritual leaders? What about teachers? Other community leaders, you know, like, they're healers too. And so just really kind of broadening our understanding of what it takes to be a healer, but what that even means. When I was in grad school, I was an international affairs fellow, and one of the projects that we worked on that I just loved was, it was an infrastructure and capacity building program in Rwanda. And so we really partnered with the Rwandan government, but also the paraprofessionals and the faith and religious leaders to really reimagine what healing would look like. And what it was meeting with and hearing from the teachers, from the community leaders, from the faith leaders. It wasn't the people that held like the most prestigious role or had the most education necessarily. It was the folks that were in the community that also experienced the trauma too. And I think that can apply to our country and our state as well.
I would hope that it would. And I guess, given you have a really global background in your family and how you grew up, but also your education, professional life, Burlington and Vermont holds a lot of families like my own that started out in other countries and kind of moved here, immigrated here, were refugees that came to the U.S. I guess, can you speak on how maybe the perspective on mental health, on healing, on the approaches that you might take, if they're different, or how to make sure that those families as well are getting the support that they need?
Yeah, I think a lot about that. I think so much of it also starts with language, like really needing to join with the community and build trust before you try to like push any kind of healing agenda. Because as we know, like, regardless of whatever intervention you are doing in the mental health space, the success of it is 100% predicated on the relationship between whether it's the community and the healer, the practitioner, or the individuals, right, in the therapeutic relationship. And so without the relationship, like, there's no healing that's going to be happening. Yeah. So really, like, joining and building trust and rapport in an authentic way. And I have seen it done really well when there are leaders in the community that their experience and even just their positionality in the community is honored and respected, when people go to them as well as community members and ask questions and listen. Like, just listen before you jump to the doing. And so once that relationship is there, I think really understanding what language is used and commonly accepted within that culture in terms of even words like healing. Is there a different word? Suffering, how is suffering understood? In many cultures, it's understood as a given. It's part of what is expected in life, not a, oh, I can't believe this happened to me, like, which is the attitude in the global north so much, right? Like, no, like, of course it happened to you. And what are some of the tools and the resiliencies within your culture, within your family, that help support you? Or I love doing multi-generational work. How have your ancestors persevered? What is the resiliency that you have inherited from your ancestors? You know, those kinds of conversations. Again, it's that lib psych stuff, that liberation psychology stuff, where you don't go in presuming to know all the things. Like, oh, I have this, like, you know, we're going to do prolonged exposure, for example, or we're going to do EMDR, and like people are going to get on board. It's you know, it's these Western trauma interventions that lose a lot of people.
I think this kind of generational, we often talk about generational trauma and the impact it's had on us. What you just brought up a little bit is more about generational liberation. Generational, the word you used was resiliency. And there is a lot to be learned from the people that came before us and what they've given to us, explicitly or implicitly. Are you comfortable talking about in your own family, what have you received, do you think, and maybe how does that impact you now?
Thanks for asking that. I love talking about that. You know, I think about my grandmother who, you know, moved from Jamaica and was only able to have visas. She had 5 children and moved from Jamaica to New York, just like so many do, for more opportunity, for, you know, to flee traumatic and unhealthy, sometimes family dynamics, which was the case in my family for her. And she only had 2 visas for her children. She had 5 children. So she took the 2 older ones that were in high school, and my mother was 8. And so her older brother was 10 and her younger sister was 6. And the 3 of them had to stay with my great-grandmother, who treated them awfully. And in Jamaica, there's colorism is so prevalent there. Classism is a really big problem. And so my grandmother and my mother were darker skinned. My great-grandmother looked very fair-skinned, could look white. And so there was trauma that was experienced, not only from the separation, you know, if you think about the developmental stage of an 8-year-old. I have an 8-year-old daughter now. So it is, I can't even imagine. And so the trauma, right, that was a part of that whole process, and the foresight and the resiliency and the strength of my grandmother having this vision of, you know, I need to get my family up here. So she came to New York and she started cleaning homes, and she's a very skilled seamstress, and so started sewing dresses and making clothes, and that was kind of how she, you know, made her way. And it was not until my mother was 16, so 8 years, that she moved to New York.
Wow.
And so, you know, thinking about all of that. And so obviously that impacts my family. That impacts, you know, me, my kids. But what I choose to focus on is the strength of the women in my family. They are some of the strongest people I know. I mean, the choices that they were forced to make, but then also the ways in which they've tried to seek their own healing and understanding and repair some of their own wounds by trying to parent differently, right? Like I've seen that. And, you know, I think about that when I sit with parents, when I'm doing family therapy, and it's so easy to judge. It's so easy, especially if your patient is the kid. It's so easy to judge the parents. But I think so many parents around the world are faced with just impossible choices.
That they have to take, my parents included, that they have to take through their whole life, and that will continue to impact them for the rest of their life. So
yeah,
think that's, I appreciate that you recognize that. And I think that that's one of the reasons why practitioners of color are so important, and specifically practitioners that understand the lived experience of their patients in a deep way such as that. And obviously we want a diversity of practitioners across the board. Practitioners of color also have their own diversity within them. So I think bringing the lived experience that you take to your practice, I imagine, makes you that much better at serving the patients that you work with. So
I hope so.
Yeah. I mean, even just hearing that, I think that's something that if you can understand it on a cellular level for yourself, then and more than just like a kind of theoretical or a read experience, then I think it makes you stronger in your work. So
thank you. You bring up a good point. You mentioned the cellular level, and you kind of like held your stomach. You know, that's something too that I think can be missing from even mental health conversations about the impact on the body. And I think a lot about that. Like when we think about, non-Western or indigenous modes of healing, so much of it lives in the body. And how do our interventions? So many of them, it's like the cognitive space, right? It's the head space. Sometimes we get to the heart space, but what about like the full body and knowing that memory, our bodies hold memory? I think that that's also a really big thing. Like, I think about just my ancestors and my grandmother and just like when she would hold me and the humming and the rocking and how I would feel that in her body. I noticed myself doing that with my children when they're upset, and it's just this kind of learned innate thing. It's because we hold so much in our bodies.